Okay, Assalamualaikum and good morning. Our class will start soon.
Assalamualaikum.
Assalamualaikum, Doktor.
Salam. Sorry terlambat sikit.
Okay, tak ada masalah.
Nak allow screen share tu sebab saya try nak share screen tak boleh.
Sebentar ya. Dah, Doktor.
Okay, thank you. Sekejap
Okay.
Bismillahirrahmanirrahim. Good morning. Shall we begin our session today, which is my session today. Semua kita Al-Fatihah first.
Recording in progress.
Okay, thank you very much. And kindly accept my apologies sebab I terlambat sikit dari ada hal. Kenapa tak boleh nak buang yang ni ya? Okay, let me put it over here. I terlambat sikit. Okay, right. Okay. So my topic today will be experimental research, and I've gone through the list of names and noticed that none of the participants today is from medicines. But however, because since I'm from medicines, I have to talk about medicines lah. Okay. Sorry, I'm not feeling well actually. Okay, let me introduce myself. Alamak, kenapa ni? Saya tak bergerak Okay, right.
Dah.
Dah. Dia dah macam, okay. Right. I'm Dr. Nidal Fatimah Ahmad. I'm from Departments of Internal Medicine, from Kuliah Medicine. And my specialty is endocrine lah. On top of that, I'm also an occupational health doctor. So basically, I'm also managing the those with occupational health problems. On top of that, I'm head of the research at the SASMEC, which is Sultan Malaysia Medical Center, editor for IM Medical Journal, advisor for good clinical practice, and I'm secretary for the clinical trial version committee. Okay, and yeah, downstairs was my previous post that I hold. Previously, I was a head for departments of education research, also at SASMEC, and also head research for climate medicine. So basically, most of the things that I do is related to research. Right. Sorry. So this is what I'm going to talk about today. And bear with me, I'm so sorry because I'm not feeling well for the past 3 weeks already. Luckily today, hari ni dah ada suara sedikit. So that's why I boleh bercakap banyak sikit, I think. Okay. So I'll be going through the introduction, what is experimental research is all about. And then I'll go through what are designs. And then followed by the conclusions of these presentations and some tips and tricks for the experimental research. In the evening, we'll be going through the technical part of how to conduct experimental research, and I'll be using the what do you call the clinical as example. Okay, let's go to the introduction part of the experimental research. Okay, when we talk about experimental research, actually we are talking about a process of researching the objective of what we plan to do in a controlled manner, so that when we come to the conclusions, when we come to the output, when we come to the outcomes of the processes, it will be precise, and the conclusion actually we support the hypothesis that we comes about. So basically, it's a process actually when we talk about experimental research. Okay, and kenapa tak ada ke bawah? Sorry. And when we do the experimental research, our goal is to determine the effect of a factor. Okay, what are the factors? This is what we call as independent variable. What we use to test onto the dependent variable. Okay, for instance, okay, if we have a drugs which is independent variable, then we would like to test on this population, for instance, anti-diabetic drug tested onto the diabetic patients. Okay, so that particular drugs is not depending on the diabetic patients to have an effect, but the diabetic patients will show an effect depending to the drugs that has been given to them. So that's why we call it as independent variable and also dependent variable. Right. So ideally, when we plan to do experimental research, okay, the research plans must show a valid and reliable result. So to be able to get a valid and reliable results, we have to specify what are the variables that we are going to use, what type of measurements that we are going to undertake to make sure that, okay, at the end of the day, when we get the result will be valid and reliable. And are we implementing any control to minimize the error? Okay, so I'll give another example for diabetic patient. Let's say my populations. Okay, I'll be talking more of diabetic because my specialty is endocrine kan. But let's say we have a group of diabetic patients. Okay, then we would like to test whether these A drugs would have an effect to these diabetic patients. So what we do, we would need to specify what are the study variables that we're going to look for. Okay, the independent variable definitely will be the drugs that we are going to test on these populations, and the dependent variable will be our diabetic patients. However, you have to specify more on the what do you call measurements that you're going to look for on this diabetic patient. So what are the measurements that we're going to look for? Number one, what are their fasting level? What are the fasting glucose level? When they fast, what are the fasting glucose level? When they eat, what are the postprandial level? And what are the hemoglobin A1C, the 3 months diabetic controls? These are the measurements that we have to take notes, that we have to perform to make sure that, okay, at the end of the day, if we say that these A drugs has has shown some efficacy, has shown a good efficacy, has shown to be effective in the diabetic patient, as evidenced by reductions of hemoglobin A1C, okay, reductions of fasting blood glucose, reductions of the postprandial level. So we need that measurements, okay, to support the results, okay. And what are the control to minimize the error? When we talk about control, we have what we call extraneous control, okay. For instance, okay, you know that, okay, when we are testing whether this drug works on this particular patients, a drug works on diabetic patient, we have to control the extraneous or the environmental factors that may have an impact, that definitely have an impact to this diabetic controller. For instance, how much they took their food, okay, whether they exercise or not. So for all these patients, we have implemented that, okay, they need to make sure that they need to take this amount of carbohydrate every day, and they need to have exercise, what do you call, regularly, 150 minutes in a week. Contohlah, this is an example. Or we may be strict in which that we would say that please do the whole blood glucose monitoring. You need to monitor your blood glucose, and you have to make sure that you monitor your drug intake, so that we make sure that those things that would affect the output will be taken care of. Okay. Now, number two, the experiment research must be well designed. Okay, if it's well designed, only then you can get accurate data. Okay, and the data will be interpreted accurately. So only by doing so, you're able to identify the cause and effect relationship between two variables. For instance, the one that I've given just now lah, kalau you dah betul-betul design dia, okay, so you can say that, okay, there is, A drugs can cause good glucose control, can cause, improvements of the diabetic control, because you have control everything, okay, you design it properly, so you are confident enough to say that, yes, it should, we are able to show the cause and effect of these two variables, okay. And you have to remember that you can manipulate the what do you call it? The independent variable, okay. Then you need to monitor the dependent variable for the changes, and record and observe and record the dependent variable effect over some time. So this is what you need to do, okay. All right, okay. This is some example of experimental research in our real world, okay, in our daily life, okay. Sometimes I suka guna contoh cooking sebab being female kan, okay. Kalau masak, okay, contoh, okay, if we put this amount of salt into this this food that we are going to cook, that you can get what do you call, the taste that is enough for us. Okay, macam kalau orang yang suka kurang garam, okay, this is enough for me. But then kalau orang yang suka lebih garam, this is not enough. You see, tawar lah macam belang ni kan. Or to those yang, memang tak rasa tak cukup lagi garam, need to put something else. Okay, something, for example, sesedap rasa lah. Ni bukan iklan lah. Okay, so you need to put something else, still tak sedap. So this is our daily life lah. Dalam kes ni, the one that I'm showing you now adalah we're going to test whether this telur yang dia nak masak ni, okay, still okay tak okay. Okay, you know that the telur, if you put into the fresh water, what will be the effect? Telur you put into salt water, what will be the effect? Okay, so you can see that they tested. Okay, kalau dia tak dalam fresh water, it goes down. Kalau tak dalam salt water, it's floating. What does it mean? So they are testing whether, okay, dalam kes ni dia nak tengok sama ada telur itu boleh float dalam salt water ataupun boleh float dalam fresh water. Kalau siapa masak tahulah yang float dalam fresh water yang bagus ke, yang float dalam salt water yang bagus. Okay, so this is what we do in our daily life. But when you go to your school, okay, you got a classical scientific experiment. I think most of you dipanggil apa, ambil science streams kan, ambil pure science. So you do have the chemistry, you do have the physics, and you also do learn biology. Okay, in our chemistry class, our chemistry teacher would say that, okay, you need to put some essays into these base solutions and look what happened. Or you put these some what they call colors, such as this yellow into the blue color, what happened kan. Okay, so you do some scientific experiment. So basically, when you talk about experimental research, benda ni memang kita buat every day. Okay, sama juga kalau macam, saya cakap bahasa Melayu lah. The same thing when you do something as in your daily life kan. Contoh, okay, what about if today I jog about 100 meter, tomorrow I jog 200 meter. Okay, at the end of the day, which one would make you feel better? So that is something you do in your daily life. You experiment it. Okay, right. When we talk about physical science, that is one of the things that I mentioned just now. You might doing it when you work in your secondary school, and social science. Okay, also you might also doing it even in your secondary school or in your daily life. Nah, right. Although it sounds that it has a straightforward logic, mudahnya kan, when you campur this this color to that color, you can get this color kan, ataupun you campur acid to the base, you can get the water plus the CO2, whatever lah. I usually cakap kalau bicarbonate, I always reason out kenapa kalau makan bicarbonate selalu jadi kemur perut, sebab bila ambil bicarbonate, you campur pula dengan acid dalam perut you kan, acid juice banyak, and become water and CO2, then it becomes bloated. Okay, so this is what something that you experience every day. It's straightforward logic, but when you try to make it a proper experiment, it might be able for you to execute. Okay, right. Now this is another example in our daily life. Okay, let's say to those yang minat menanam lah. Okay, I minat tengok saja, tak minat nanam. Okay, so let's say you were given two plan A and plan B, the same. Dia mesti sama. You punya dependent variable must be the same what do you call the same sample lah. Dia punya karakteristik masih sama. Contoh kalau ni adalah pokok pokok bunga, what do you have? Carnations. But they have roses. Let's say roses. Nah, plant A is roses, plant B also roses, were given to your friend. Okay, lepas tu nak tengok, okay, kalau I tanam, yang mana yang akan hidup, hidup segar dan ada bunga kan, ada daun banyak. So, both the plant both the roses tu, you tanam, dua-dua you both fertilizer, dua-dua you siram every day. Plant A you letak di luar rumah so that it will get enough sun. Okay, and plant B you letak dalam rumah. At the end of the day, you tengok plant A. Okay, bila you letak you bagi intervention which is the sun, it grows well. Plant B yang you letak dalam rumah, yang you tengok kalau letak rumah, okay hidup tak? Mati. Okay, so over here, okay, you can say that the dependent variable over here adalah the plant. Okay, the independent variable adalah you punya intervention which is the sun. Ni yang standard care ni adalah extraneous variable cakap tadi lah, yang benda yang you kena make sure you take care so that nanti dia tidak mempengaruhi you punya output. Okay, at the end of the day, kalau you get the result, you boleh confidently say that, okay, the plant will grow well and will produce a flower if they were given adequate sunlight. Okay, now in science, okay, you may have experienced this kind of experiment also. Nah, let's say you were saying that, okay, manusia kalau diletakkan berseorangan, okay, they would behave differently if they were given a friends in their environments. Okay, so what you need to have adalah dua lah, two groups, which is the control group, which is orang yang you letak with a friends, versus the experimental group, orang yang you letak seorang-seorang. So you get experimental groups, okay, and you get a control groups. Barulah nanti bila you dapat the result, you boleh compare because you got something to control. Betul lah, orang yang kalau you letak in a group, they would behave normally because they have somebody to talk to, somebody to share their their feelings, kan. Tapi compare to those yang you letak seorang-seorang, must be bila you jumpa serabai lah, they would talk nonsense lah because they are not communicating, they don't have anybody that would share their feelings, that would tell this is wrong, this is right, kan. So this is for the social science punya research lah. You would like to assess behavior of a person kalau dia been isolated versus if they live in a community. Okay, but you have to remember that in this kind of cases, kalau you nak make sure you punya result tu bagus, you need to have a control group. Boleh boleh kata the output of the experimental group tu betul. Okay, right now. Nah, hypothesis testing in control environments lah. Okay, so have study population randomization, you randomize into experimental groups and control groups. And the experimental group terpanggil intervention groups or control group, tak ada intervention, hanyalah sebagai comparison so that when you get the when you get the result, you are confident enough to say that the output is due to interventions. Okay, right. This is for the science. Okay, clinical trial. In clinical trial, okay, let's say we have two drugs, drug A or drug B. Okay, so we plan to test whether drug A is much better than drug B. So for you to test the drug, then you have to have the population. Okay, let's say this drug is an antihypertensive drug. Okay, so your population must be a group of patients with hypertension. So you need to make sure that you divide your study population into two groups using randomization. Okay, tak boleh ada selection bias. You must do it randomly. Okay, and then one of the population will receive treatment A, another population will receive treatment B, and then you observe over times, okay, for the drug A and drug B to have an effect, and then you compare the finding or you compare the result, you compare the incidence or you compare the outcomes of the experiment just now. Okay, so here your drugs, which is drug A and drug B, this is what we call the independent variable because that drugs does not need that population to have an effect. Okay, dia tidak bergantung pada mana-mana pun. Whereas the group that receive the drug A or drug B, which is the study population, adalah you punya dependent variable because that particular hypertensive patient is dependent to the drugs for them to show an effect, and the drug itself, what we call the cause, and the the output, the outcomes, the incidence itself, we call the effect. So now you are able to safely say, confidently say that there is a causal relation and effect relationship between drug A and hypertensive patients. Okay, right now, so when we compare the field experimental research yang I tunjuk tadi, which is a clinical trial research, versus the lab experimental research, maksudnya yang you buat dekat lab saja. Kalau untuk clinical, kita panggil the preclinical study, kalau and versus clinical study lah. So untuk lab experimental research, that particular experiment is conducted under control conditions. You control everything from the Z because it's inside your lab. Okay. Whereas kalau kita buat dekat field, kalau kita bagi dekat real patient, okay, kalau yang pre-clinical tadi, biasanya apa yang kita buat adalah kita tested on the what do you call, on the animal lah, kita panggil animal study kan. So that particular animal tu, dia punya environment tu memang kita control from A to Z. Okay, compare to the real population that when we conducted in what do you call, in the real world, in the natural setting, dekat dalam dunia ni, you tak boleh nak control everything of the human. Memang you kata okay, you were supposed to make sure that you compliance to our diet advices. You were supposed to exercise 150 a day, what do you call, minutes in a week, but you cannot control it, strictly as conducted in the lab. Okay, so in natural setting, you might have a different result lah. And lab, in terms of lab experimental research, because you are able to control the conditions, okay, it allows you to have a greater precision and accuracy of the result. Whereas kalau untuk field, whatever finding that we have, we call a realistic observation, realistic result, because this is what humans do. Then what you cannot control everything. Okay. So in terms of like experimental result, because it's it's conducted in a control condition, it is not always representative of the real world conditions. Okay. And when the result of is not representative of real world condition, that experiment's finding may not be generalizable to the population at large. Okay, because just now, okay, bila you buat dalam control environment, bila you nak bagi dekat dengan what do you call, the real world, the real patient, you may not be able to generalize it. Okay, whereas kalau untuk field experiment, okay, you know that the condition is not as controlled as the lab experiments. Okay, and the result may be subjected to more source of error lah, because banyak benda-benda yang tak boleh nak control. Okay, right. Now, so what are the good things and the bad things with regard to experimental research? The good thing adalah, okay, generally you are able to have a complete control of the research outcome, provided that, okay, walaupun kita kata complete control of the research outcome, okay, you need to control many different factors. Yeah, I mentioned just now kan, you need to control you punya extraneous factors. Okay, then when you do experimental research, you can get a quick, accurate results, and you are able to conduct research in short times. And if you are able to get a quick result, and you are able to test it, multiple solutions at the same time, you are able to produce a new products or solutions. Okay, so this is the good things lah. And the bad things adalah, bila you need to control everything, so you need to use, specialized equipment, specialized employees. You need to hire professionals, so it's quite expensive. Okay, it's also time consuming, sebab walaupun tadi kita kata we can, have a solutions quickly because we can test it multiple solution, but for you to be able to have that solution, to have the outcomes, you need to create the right condition to make sure that you are able to test the right variable. Okay, kalau you tak boleh create the right conditions, you akan banyak subjected to errors lah. Kan? And difficult to control because you need to provide the right conditions and the control factors that may influence the outcomes to get good results. Okay, you can get, those extraneous yang you susah nak control, and risk of inaccurate findings. So it happens kalau the researcher make mistakes or conditions yang you try to make it right, so tak dapat juga. So at the end of the day, the result might be inaccurate. Okay, right now, let's talk about experimental research designs. When we talk about experimental research design, as mentioned just now, okay, this is the logical model lah. Okay, by right, you were supposed to have experimental group, ataupun kita panggil intervention groups, ataupun kita panggil treatment group versus a comparison group. Okay, and these two groups were supposed to have a pre-tested to know their baseline condition, and then the intervention groups ataupun treatment group ni kita akan bagi interventions, and then we test, then we have another test which is the post test to see, compare the result between those in the control groups or comparison group versus the intervention groups. Okay, Now, to be able to get, participants, you need to do a sample collections, okay? And for you to make sure that you are able to come up with the outcomes for you to compare with, you have to develop your measurement tools, okay? Macam contoh yang buat tadi lah, kalau you nak tengok diabetic control, you need to know what are measurement tools that you're going to use lah. Okay, kalau in terms of hypertensive control, then you know that what are the measurement tools that you need to have lah. So you need to make sure that you use the right measurement tools, okay? When we do the interventions, you collect the data, and then once you get all the data, you need to have to choose the right method untuk you process the data and analyze the data. Only then you can get the valid and accurate result. No? Now, in terms when you are designing a research, there are a few requirements that you need to have lah. Okay. Number one, sample collection. Yang aku tadi kan, you ada satu control group ataupun comparison group, yang kedua experimental group. So you need to choose the right sample, study sample. So you need to have the right study population, and you need to have some inclusion exclusion criteria, so that nanti bila you recruit the patient, you recruit patients who are really eligible for your study. Okay. And then bila you have the sample population, you have to make sure that when you divide it into comparison groups and experimental groups, they are randomized properly. Nah, bukan you selected without any randomization lah, because if you are doing so, you are subjected for selection bias. Tak boleh lah. Contoh, dia kata, I nak make sure tak, kalau I test this drug A ni, drug A shows, it has a good effect on this study population. So, you ambil yang those with dah in the beginning have a good sugar control, you know that they have the abilities to come to hospital regularly, and they were those who are educated enough, so that when you give advices, you give instruction, they would understand you easier. That is a selection bias. That's why kita kata you tak boleh buat macam tu, you kena randomize it. Okay. Now, when we talk about measurement tools developments, okay, you need to make sure that you tahu apa you punya independent variables, apa you punya dependent variables, and apa you punya extraneous variables. No? Okay, right. When we talk about independent variables, it is the variable or a factor that can cause changes to your experimental or treatment variables. Okay, dalam kes ni, the antihypertensive drug or the anti-diabetic drugs. Your dependent variables adalah the one that we have changes due to your independent variables. So this is your measured variables. What are the things that you're going to measure to make sure that you are able to show that, okay, there is a changes in my study population based on this outcome. Okay, and your external variables adalah your control variables yang I mention tadi lah. Okay, right. So if you are able to effectively control your external variable, you are able to avoid confounding ataupun spurious result. Okay, so you really need to make sure identify what are the external variable that you can control to make sure that bila you get the result, your result tu tak ada the confounders, sebabkan berlakunya perubahan because of that confounders. Okay, right. Now, this is the same thing I mentioned just now, cuma it's just to highlight to you that, okay, when we do that study just now, the plan A and plan B, yang you set up in the house, satu you set up outside the house. Okay, you would like to look for the you would like to establish the cause and effect relationship between that two variable. Contoh tadi, the sun, okay, cause the plant to grow well. So this is the the purpose of your study just now. Okay, now let's look at the details of the types of experimental research, okay, that you might be doing or you plan to do. When we talk about experimental research design, we divide it into pre-experimental research design, quasi-experimental research design, and finally true experimental research design. So this is three common types of experimental research design. Okay, so what are the subtypes of the pre-experimental research design? Okay, when we talk about pre-experimental research design, okay, this is the simplest one. It follows basic sets in experiments, is very practical, okay, but it lacks in several areas of true experimental criteria. Okay, walaupun kita kata experimental research, design type, tapi dia adalah pre. So that's why they lack several areas of really true experimental criteria. So when we say pre, maksudnya is a preparatory ataupun prerequisite for you to develop ataupun to perform through experimental. So before you perform the true experimental result, okay, this pre-experimental research happens before that. Okay, usually when we perform the pre-experimental research, okay, because you tahu it's very practical but lack of true experimental criteria, tapi you still perform the pre-experimental research bila you nak test the feasibility for further studies. Okay, contoh, this is what we call a pilot study kan. You nak test sama ada bila you bagi this drug A to that particular groups of patients, it just have an effect. So usually you do it in a small numbers of patients yang tak strict lagi punya kriteria, and then ada tak possible changes. So kalau ada, so it's feasible for you to have a further study. Okay, kenapa perlu? Why do you need a pre-experimental research? Because bila you nak buat full scale a true experimental study ni, this pre-experimental research dia macam guarantee for you that when you perform, okay, the true experimental study in a full scale, that particular true experimental study will be a successful study because you dah ada the so-called preliminary result. Okay. Now, in the case of pre-experimental study, okay, minimum of one dependent variable is observed. You may have more than one, and then you're going to observe for the effect of independent variables that we presume to cause changes. Okay. In the pre-experimental research, there is no control groups to control the extraneous variable as comparison. So, bila tak ada control group, bila you do not control the extraneous variable, okay, you can claim that the experimental groups who receive certain treatments has experienced changes. Okay, you can claim, but you cannot conclude that the changes was caused by the treatment itself. Why? Because you don't have the comparison group. You don't have the group to compare with. Kalau tak bagi apa jadi? Kan? And you also don't control the extraneous variable, and that particular changes might be due to extraneous variable. Contoh tadi kan, yang saya cakap tadi, kalau you letak plan A dalam rumah, plan B di luar rumah, and then dia kata, oh, plan B yang di rumah ni hidup segar sebab ada matahari. Okay, tapi you tak control the extraneous variable, which is the fertilizer, which is the air, and dalam rumah you tak bagi the fertilizer, the right amount of what you call water, kan? So that particular things, that particular variable, okay, was not controlled. So you cannot conclude that. You just can claim only. Okay, right now, this is an example for pre-experimental research. Nah, simple, a very simple one. You ambil satu group of population. Let's say you ambil diabetic patient. You give a drug to this diabetic patient. Okay, this a drug which is your interventions, which is your variable, what do you call independent variables, and you collect the data, and then you tengok the data analysis, the finding. Katakan total of 100 patient yang you recruit ni, 70 of the 100 patients improve in terms of diabetic control. 30 of 100 moderately moderately improve. One of 100 develop reactions. Contohlah, this is as an example. So you can claim that this drug A would have an effect to the diabetic patient because 70 or 100 patient is improved. Okay? Tapi you cannot conclude because you don't have a comparison group in which that they would act as control group. Okay, kalau dia orang tak ambil dia, ada improvement ke tidak? Okay, right now. So when we talk about the pre-experimental research, there are three so-called common type that I use. Number one is one-shot case study. Number two, one group pre-test, post-test, and finally, static group comparison. In one-shot case study, okay, only one variable, one study group is investigated, and you conduct the test, okay, after an intervention, okay, presume to cause the change that has taken place. Okay, That's why kita panggil post-test research. Maksudnya, you ambil this variable, you bagi intervention, you test. Okay. So, that particular test only conducted after the intervention. That's why kita panggil juga sebagai post-test research. Okay. So, limitation untuk one shot case study, simple, kan? Mudah sangat. Tapi, you again, especially just now, you tak boleh nak conclude saying that, okay, your intervention work or not. Because there is no pre-test, there is no control group. Okay, let's say tadi dia kata I dah buat post test memang ada HbA1c control. Tapi pre-test dia tak ambil HbA1c. For all you know, before you start the test, before you start the intervention, HbA1c from the beginning dah control. The glucose already been controlled from the beginning. So you don't have the pre-test to compare to say that yes, in this intervention, okay, it shows that this drug A works well. And there is no control groups to compare with. Kalau tak ambil, jadi macam mana? Okay, this is one short case study. As I mentioned just now, you select one group, one big group, you bagi treatment, you buat post-test. Okay? And you declare, you claim that, okay, this particular intervention works for this patient. Okay? So this is another one-shot case study example for social science. Okay? They do some intervention. Let's say you have a class of students, 30 pupils, okay, 30 students, and when they have a normal learning days, following the schedule timetable kita kan, okay, average result was 57 bila exam. Buat post test, result 57 je. And you know, you were trying to say that, okay, I need to improve the academic performance by doing some intervention. What intervention? Okay, you ambil the same group of what do you call population just now, the student tadi, that 30 people tadi, okay, beside the normal learning days class, okay, you plus juga nut prep. Malam-malam you bagi what do you call kelas tambahan. And then when you do the post test, okay, average score adalah 69%. Maksudnya ada increment daripada previous result yang tidak ada intervention. Okay, right. Okay, limitations. Cannot conclude the effectiveness of the intervention as there is no pre-test. You might be arguing with me, you cakap, ni kan pre-test je kan? Tak. Ini adalah dia punya performance for dia punya other classes. Bukannya the same thing. Okay, for instance, yang ni dia kata, oh, kalau untuk BM, 57% got average score. Tapi ini yang dia buat untuk nak prep untuk BI class ataupun science class. Kan, dia tak ada the same pre-test for that particular variables yang you tested. Okay. Right, now. Number 2, one group pre-test post-test. Jadi, one study variable juga. Okay. You ambil satu group saja, tapi dalam ni you combine both post-test and pre-test. So ada pre-test before the intervention begin and ada post-test after the intervention begin. Okay. Again, you boleh claim that, okay, by doing intervention there is an improvement. Tapi you tak boleh conclude sebab tak ada control group for you to compare. Okay, so you cannot conclude that my interventions works well. Okay, so you select one group of study population, you bagi and then you do a pre-test before you start treatment. Okay, lepas you start treatment, you bagi post-test. Okay, and then you see the result. This is the same thing I mentioned just now. Bezanya, oh, I salah press ni. Okay, I salah paste. Okay, dalam ni you dah pre-test awal-awal. Okay, lepas tu dapat result. Bila you buat nut prep intervention, you buat post-test, ada increment. Okay, right. So you boleh kata ada increment, tapi tak boleh nak conclude saying that increment, that improvement, okay, adalah because of your interventions, because there is no control groups. Right. So limitation, there is no control group, so you cannot conclude that your interventions is effective. Right. The third one adalah static group comparisons. Okay. When kita kata comparison, it must be more than one group. So you have at least 2 groups. Okay. And then these particular groups ni divided into one yang receive interventions, the other groups held static. Okay. All groups are post-tested and you observe difference between the 2 groups, and then when you get the result, the difference between that 2 groups, you assume to be a result of the treatment. Okay, but you cannot conclude for this kind of study Okay, sama ada that interventions is effective enough because there is no pretest for the baseline comparison. Okay, basic and static group comparison dengan what do you call pretest only tadi. Kalau pretest you hanya ada satu group, kalau static group comparison you ada dua group. You boleh compare in between these two group, tapi you tak boleh compare sama ada improvement ke tidak because there is no pretest. Okay, so again you have you choose study population, you divide it into experimental groups dengan control groups. Experimental groups you bagi treatments, control group you just observe. At the end of the day you buat post test for these two groups. Okay, now this is another example. Okay, let's say group 1 you buat extra teaching, you tengok result. Group 2 you bagi normal learning schedule, tengok examination result. Okay, that is exactly act as the post test lah. So again you cannot conclude because there is no pre-test and there is no, furthermore memang you bagi into two groups tapi it was not properly randomized. Suka hati je bagi group 1, group 2, group 3 tapi it was not properly randomized. Maksudnya di sini adalah you might be selected, you know, patient students according to your practice, not due to inclusion criteria. Contoh, you kata group 1 ni adalah student yang tak berapa pandai dan you know, coming from the B40 groups. So you need to make sure that you give the extra teaching so that nanti they are able to perform as well as these two group. Katakan group 2, group 3 ni adalah orang yang F40, T20 punya anak-anak. So you will say that they can get their own classes outside, but they did not lah actually, kan? Okay. So basically there is a selection bias over there. So there is no proper randomization and there is no pretest. That's why dalam case static group comparison, again you cannot conclude whether your intervention is effective or not. Okay, right. So we have gone through the pretest only, the pretest and post-test, and also static group comparison. Okay. Now, what are the good things of conducting pre-experimental research after you listen to all to what you call to those facts just now? Okay. The good things adalah it is cost effective. Okay. Sebab you just need to run it in a small number of what you call population. You don't need to hire professional. You don't need you know all these equipments or what do you call measurements yang canggih-canggih kan. Okay, so it's very cost effective and provide you a potential explanation whether if you conduct a further research in a full scale it will, you know, successful or not. So that's the reason why ramai juga orang buat pre-experimental as a pilot study for them to conduct a true experimental study in the future. Okay, what are the advantages ataupun cons dia? Lower validity lah. Difficult to assess the observed changes significance. Sebab tadi tak ada control groups kan. Okay, tak ada pre-test, tidak control juga dia punya what do you call the control variables atau kita panggil assurance variable just now kan. And higher threat to internal validity because very little control over the research. Okay, and very difficult impossible to rival hypothesis explanation. Remember just now I cakap boleh claim tapi tak boleh conclude. So it's very difficult lah. Kadang-kadang keluar juga rival hypothesis yang kata, oh, this is because of, you know, what do you call the flower, the plant grow well because of the fertilizer that I use, not because of the sun. Kan? Ada rival pula hypothesis from there, kan? Because you tak control dia punya extraneous variable. So these are the things that you have to remember lah. Boleh buat the pre-experimental, but there are few things that you have to remember that will, you know, affect you punya outcome actually. Right. Now, let's go to the quasi-experimental. Okay. Quasi-experimental research design ni, okay, bila kita kata quasi, maksudnya is a partial, is a half, or sometimes kita panggil a false experimental research design ataupun pseudo. Okay. Why kita panggil sebagai false, pseudo, or partial? Sebab it resemble actual ataupun true experimental research tapi dia tak sama. Okay. Why tak sama? Yes, we do use comparison group, tapi that comparison group, that control group is not randomly assigned. Okay, tadilah you ada selection bias di situ. Okay. However, sometimes we do perform quasi-experimental sebab randomization is impossible due to ethical issues or practical reason. Contoh kan, if you have a group of patient with the mental problems, let's say anxiety disorder, and you know that this group of population with anxiety disorder, they need to be referred to clinical psychologists for them to undergo some cognitive behavioral therapy, some counselling, kan? Okay. And then kalau lah you kata I nak test lah drug A ni kalau bagi dekat this what do you call anxiety disorder patient, it works well or not. So by right, kalau you nak tengok, you kena versus lah yang dapat cognitive behavioral therapy, okay, tanpa drugs, okay, versus yang dapat cognitive behavioral therapy with the drug sepatutnya. Tapi tidak boleh buat sedemikian. Okay, because ethical issues is not fair. Dia tak boleh yang ni tak dapat what do you call cognitive behavioral therapy ini dapat. Okay, so because of that ethical issues, you need to perform quasi experimental. Okay, so what you do adalah you matching, okay, what do you call the study population to improve comparability and comparison groups. Okay, maksudnya you choose group that are as similar as possible, and or you control for them in their analysis. Okay, right. So this is what are the things which is similar between quasi and also pre-experimental adalah both are used when true experimental research designs are impractical. You boleh guna bila your true experimental research designs are impractical. And both quasi and pre ni easier to carry out, but the lack of the rigor of true experiments. Okay, mudah, tapi the lack of the quality of the true experiments. Okay, what are the differences? Okay, in between quasi and also pre experimental. For quasi, you don't have the what do you call, when you don't have the what do you call ability to select, you don't perform randomizations, and there is no active manipulation also. Okay, and when you assign subject to group, there is no randomizations, and the comparison group is predetermined to be comparable to treatment group. So this is what difference between quasi and true experimental. Okay, and what is similar between quasi and true experimental adalah both you manipulate the independent variables with the aim to establish a cause and effect relationship between these two independent variables and dependent variables. Okay, right, now this is example yang I bagi contoh tadi lah. Okay. Katakan, okay, you ada a group of what do you call a patient lah, tapi you nak try treatment, tapi unethical for you to give a new treatment without performing, without conducting, without administering, without giving the standard treatment to your patient. Okay, so tak boleh sebab it's unethical. So what you do adalah, okay, you pilih subjek tapi you tak randomly assign. Okay, so satu subjek yang mana you buat cognitive behavioral therapy macam biasa, satu subjek lagi you buat juga cognitive behavioral therapy, tapi ada kawan-kawan you yang berminat nak try that particular ubat, okay, and you add on this group. So this is what we call the quasi experimental. Tak sama macam nak 100% sama dengan true experimental. Okay, right. So any systematic difference between these two groups, okay, you can reasonably confidently say that the difference arises from the treatments and not other confounding variables. Boleh kata lah, because it's better than the pre-experimental just now. Okay, right. Now, there are 3 types. Sebenarnya banyak quasi experimental research. Okay, tapi I hanya akan highlightkan the 3 types yang commonly be used. The first one adalah matching post-test only control groups. Second, matching pre-test and post-test control groups. Yang ketiga adalah interrupted time series. Okay. When we talk about matching post-test only control groups, okay, this is the commonest one that being used, also known as non-equivalent group research. Dalam kes ni, okay, you choose 2 existing groups from the same population, okay, who appear to be comparable. Okay, appear to be comparable because you don't randomize it in you don't select it using a strict inclusion exclusion criteria, and then the groups are created by self-selections, administrative decision, and all this technical. Okay, one group receives treatment, another group will act as comparison, and both groups will be observed after the treatment has been administered. Both groups are exposed to post-test, and the scores between the scores that you perform to these two groups, the difference between the scores between these two group you guna untuk compare whether your interventions works well or not. Okay. Sorry. Right. So this is an example. Let's say you got 300 patients with obesity, okay, and they got health complication. And out of the 300 ni, you pick up 20 male patient dengan and another 20 male female patients. And that 20 male patient you group sekali because of the gender, male tak sekali lah, and female tak sekali. Okay. And for the male patient, you bagi interventions. For the female, you tak bagi interventions. And you do a post test. Okay. Bila you buat post test, you kata, okay, male patient was found out to have less obesity cells concentration as compared to female patient. Findings, betul findings. Tapi, you tak boleh nak claim saying that, okay, that particular less obesity cell concentration is due to your intervention. Okay, because dalam female patient tu you tidak bagi the intervention, so how are you going to compare whether female kalau bagi intervention will have less obesity cells or not? Okay, so this is why we call COSI, because dia tidak 100% sama dengan true experimental. Okay, now nombor 2 adalah matching pretest post-test control groups. Okay, tadi ada post-test saja, sekarang ada pretest dan post-test control group. Again, you choose two existing groups, the same population who appear to be comparable. One group receive treatment, another group acts as a comparison. Tapi dalam kes ni adalah apa yang beza, you test before you bagi interventions and you test after you bagi intervention. Okay. Alright, now, so dalam kes ni, you ambil 300 patient, you ambil 40 patients, you tested for the obesity level. Okay, let's say you tested for the obesity cell level. Okay, and then you pass member with similar levels of obesity. Contoh, tadi mild satu group, moderate satu group. Contoh lah. Okay, let's say yang moderate tu, you bagi treatment, yang mild tu, you tak bagi treatment. So, they will act as the control group. And then, you do a post test. Okay, you tengok, yang mild tadi, without treatments, adakah maintain mild, yang moderate, yang with the treatment, adakah become less. So, let's say, result dia adalah, male was found to less obesity cells concentration as compared to female patient dalam group yang sama yang dapat treatment compared to yang tak dapat treatment. Okay. So this is what we call matching pretest and post-test control groups. Okay. And finally, the time series research. Okay, this is a variant of pretest and post-test research. Okay. The similarity between what do you call the pretest pretest post-test research adalah there is measurements of dependent variable both before and after the treatment. Kita buat pretest dan post-test. The difference adalah dalam time series research ni, walaupun kita kata dia adalah variant pretest dan post-test, dia berbeza sebab they got multiple pretest and multiple post-test. That's the thing yang membezakan dia antara nombor tadi kan, pretest dan post-test, matching pretest dan post-test tadi. Okay. Now, it can be an interrupted time series or it can be in terms of multiple time series. Okay. And this particular time series research is very useful kalau sebenarnya you nak measure the effect of treatments over long period of time. Contoh, kalau dalam sebulan, the finding macam ni. Dalam 3 bulan, finding macam ni. Dalam 6 bulan, finding macam ni. So, it's useful for this kind of research. You nak tengok the effect over time. Okay. Throughout the experiment, okay, the intervention need to be administered continuously, and that particular group study need to have a predict measurements to look for the treatment effect. So this is the thing yang membezakan antara pretest post-test dengan the time series, because you got continuous administration of treatments to get the predict measurements of the treatment effects. Okay. Now, this is example just now lah. Okay. This patient is pre-tested few times and also been tested few times. O2 ni yang post intervention. O1 ni adalah before intervention. They've been tested few times before an intervention was given to your patient. After intervention given, then they were tested few times again. Then multiple pre-test and post-test. Okay. And when we talk about time series research just now, yang ada dua tadi kan, interrupted time series dengan multiple time series. When we talk about interrupted time series, a single time series that is interrupted by intervention, and do you analyze the series of the changes before and after the intervention. Maksudnya you ada satu time series, you buat what do you call, you bagi pre-test, you buat pre-test, you bagi intervention, you buat post-test, okay, multiple, okay. And bila you tengok in the interrupted time series design, it consists of repeated observation over time with a clear interruption point where the intervention occurs. So you focus on detecting changes in the time series due to your intervention. And when you do a statistical analysis, you use segmented regressions analysis. Okay, so this is example lah. Contoh, you nak evaluate the impact of new policy on crime rates by assessing the monthly crime statistic before and after the policy implementation. So, ni yang pre-test ni, you buat test before you implement your new policy. After you implement your new policy, you tengok, oh okay, after 1 bulan, the numbers of crime reduce this amount. 3 bulan, this number of crime reduced to another what do you call, percentage. And after 6 months, the what do you call, the crime series reduced to another percentage. Okay, the what do you call, the serial time series, okay, being interrupted only due to your interventions. Whereas in multiple time series, you got multiple time series from different unit. Tadi dah satu unit saja. Okay. Example, different locations or groups to compare the effects of intervention across this unit. You've got several time series, some of which may experience the intervention while others do not have intervention. You call it as control groups. And you compare the changes in the outcome variable across the different series. And dalam case ni, you control the external factors by comparing treated and untreated units. Okay. So, ni apa beza dia dengan interrupted time series just now. Okay. Contoh, you analyze the impact of health intervention in multiple cities where some cities implement intervention and others serve as control. Just now tadi, you ada satu city saja yang kita implement polisi. Jadi, sebelum kita implement polisi, you buat pre-test. Lepas implement polisi, you do the post-test. So, satu je, satu series je. Which is, case tadi, that series kita kata that particular cities only. Contoh, dekat Kuantan area only. Dalam case ni pula, dalam case ni, kalau multiple time series ni, you buat bukan dekat Kuantan saja. Mungkin buat kat Kuantan, Terengganu, Kota Baru. You got multiple time series. Okay. Then, di Kuantan saja yang you implement this policy. Contoh dalam case ni, health intervention. You tengok, tempat-tempat lain tu yang you tak implement this intervention, apa dia punya finding dia. So, you boleh compare lah. Okay. So, this is what we call multiple time series because there are many locations. Okay. That you include into your studies, and one of them having given intervention, the rest to you add as comparison. Okay. So generally, when we compare the interrupted time series and multiple time series, okay, the interrupted time series focus on single series before and after intervention, whereas multiple time series compare multiple series lah. And furthermore, they allow for control group. Remember just now, Kelantan dengan Kuala Terbaru dengan Kota Terengganu menjadi control group for health intervention. Because hanya Kuantan je yang menerima health intervention. Okay. And interrupted time series ni provide insight into the treatment effect over times in one content only, whereas multiple time series offer a broader perspective by comparing multiple contexts. So you got multiple contexts, you got multiple time series in the multiple time series. Okay. Right now, so we have gone through the what they call the types, the variants of the quasi-experimental. So what is a good thing of conducting quasi-experimental research? It's a higher extendability because it has more like real-world setting, suitable for real-world natural setting than a true experimental research design. Okay, because you buat dekat real world. You conduct tadi lah, you conduct dekat Kuantan area. Okay, bukan buat kat dalam lab kan? Okay. You conduct dekat mana tadi, dekat Kota Baru area kan. So it's more like a real world setting. So has higher extendability. Okay. Has higher internability because you're able to control for confounding factors. You evaluate the impact of internability under naturally occurring conditions. So you have a better control for your confounding variables. Okay. And it's more feasible if you have a time and logistical constraint. So it be able to establish a causal relationship, okay, by performing quasi-experimental compared to the true experimental. Okay, so this is feasible compared to true lah. Right now, what is the con? What is the bad things about the quasi-experimental research? Okay, it's a lower internability. Tadi kita kata higher external higher internal, tapi ada dia boleh juga lower internal validity sebab you tak properly randomize your study population. You just group them into a matching ataupun comparable criteria only. Okay, so there is no randomization. So statistical test can be meaningless lah because too many confounding factors to count. Because you tak control you punya extraneous variable kan. So maybe your statistical test will be meaningless. As a lower externality because you have no control over extraneous variable. Kan bila benda tu berlaku dekat real world, okay, ada benda-benda yang tak boleh control. Okay, and there is presence of selection bias. Okay, so when you look at the result, your result might be weak and less reliable results. Because why? Because there is absence of control groups, lack of control over the research setting, and etc. Okay. Right now. So as a conclusion, for quasi-experimental research, manipulations of independent variable without random assignments of participants to conditions or orders of conditions. Okay, you do have manipulations of independent variable, tapi without random assignments. Okay, you may be able to eliminate the directionality problems because it involves manipulation of independent variable, but you are not be able to eliminate the problem of confounding variables because there is no random assignment to the conditions. Okay, as a conclusion, okay, kita katakan bahawa quasi-experimental research ni has higher internal validity than correlational studies but lower, okay, than true experimental research. Higher than pre tapi lower than the true experimental research. Okay. Now, let's look at the ideal one, the true experimental research design. Okay, this is gold standard. Okay, because that's why it's panggil ideal one because gold standard in research design. One of the most rigorous of all research design. Maksudnya kat sini ada very careful, a very detailed research design. Okay, extremely thorough and carefully designed. What do you call? Experimental research. That's the reason why. Okay, it is the most accurate types and relies on statistical analysis to approve or disapprove hypotheses, and the only true design that can establish a cause and effect relationship within a group, okay, confidently. Okay. Alright. In terms of methodology, when we are trying to perform true experimental research, okay, we have to know that we need to have at least two group, okay, who are randomly assigned, okay, to study population, study subject who are randomly assigned, okay, and that assignments must be according to different treatment level. And you need to have one control group, okay, this is a must, okay, tak boleh tak ada, is a must, and this control group can be manipulated and not subjected to change, okay. Experimental groups will explain the change such as treatments or interventions, okay. So you give intervention to your treatment groups and you observe the outcomes. And through experimental research, it can be carried out with or without a pretest. Okay. Why do you need to perform a experimental research? Because you need to manipulate the independent variable through treatments or interventions. So manipulation must be there. You need to control the independent variables, okay, by doing a manipulation. What is a manipulation? You give treatments or interventions. Then you need to control. What control? You need to need to have a control groups. Number two, you need to control the extraneous variables. Okay. Apa ciri ketiga dia adalah randomizations. Every subject has an equal chance to be assigned into the control group or experimental group. Okay, must be a randomization. And finally, it must be a random assignment because it needs to make sure that there is no pre-existing condition that can influence the variables and mess up the results. Okay, right. So there are three types of true experimental: post-test only control group, pre-test and post-test control groups, and Solomon group 4. Okay, for post-test only control group research, okay, the subject are randomly selected and assigned to two groups, control groups which will act as comparator, and experimental group in which that they would receive the interventions or treatment. After close observations, okay, bagi experimental groups dapat intervention, Okay, you observe, then you post-tested. Conclusion is drawn from the difference between this group. Okay, so bila dapat post-test tu, you buat conclusions. Okay, there is a difference from the pre-test post-test randomized control trial because dalam kes ni apa beza dengan pre-test post-test randomized control trial ataupun pre-test post-test control group research. Dalam post-test tak ada pre-test before the intervention was given. So that's the thing yang membezakan. Okay, so again we ambil satu group of patient, for instance, okay, a patient with the what do you call dementia. Okay, you ambil this group of patient, satu group, then you randomly assign. Randomly assign bukan you just select the patients according to dia punya comparable punya what do you call informations lah. Okay, you randomly assign into treatment groups ataupun to control groups. Okay, then you bagi treatment yang you do a post test. Okay, this is the thing yang saya cakap tadi lah kan. Okay, randomly assign into experimental groups and control groups. Okay, and you just observe and then you bagi intervention. You tak buat pre-test tapi you observe saja, you bagi interventions and then you do a pre-test. Sorry, you do a post-test, tengok whether your intervention was effective or not. Okay, whereas dalam case control group, okay, you just observe je. Okay, sampailah at the end of the study you do a post-test. Okay, now so what is the good thing about the post-test only control groups? Treatment groups and control groups are equivalent at the baseline. Kan tadi randomized. Okay. External factors are control and you are able to maintain participants' anonymity and that particular post-test control groups result is not affected by reaction to pre-testing. Dia tidak sensitized lah. And it can be done when a pretest is not possible. Usually kita buat post-test on the control group bila mana the pretest is not possible. Okay. Usually the one yang dalam biasa control trial, what do you call RCT randomized control trial adalah contoh dia kata-kata kita nak population of patient yang datang dengan what do you call head injury, let's say intracranial hemorrhage due to MVA, motor vehicle accidents. Macam mana you nak pretest? You tak boleh kan? So, memang takkan ada pretest. Okay, bila patient datang, okay, kita ambil all the particular, dia fix inclusion exclusion criteria, kita masukkan dalam, kita randomize into the what do you call intervention groups atau control groups. Okay, randomly assign lah. So, kalau dia masuk intervention group, okay, this particular patient akan dapat this treatment. Okay, kalau yang control group tu, dia hanya akan dapat standard treatment. Kalau dalam intervention group, akan dapat intervention dah. So, then you tengok result dia, post-test dia. Yang mana better in terms of outcome. Okay. Now, what about the cons atau the disadvantages for the post-test only? High risk of attrition bias. Okay. The intervention's effect on subgroup is not clear. Kan. Require a large sample size and less irreversible than observational design. Okay. What do we mean by that? The treatments and control groups are equivalent at the baseline. Why is it important? Now, walaupun kita kata treatment groups and control groups are equivalent at the baseline, tapi kita tidak kata they are expected to be perfectly equal. Okay. Maksudnya, kita kata that control group and treatment group, contohlah, the age group will be between 30 to 50. Tapi tak semua umur 30 to 50 betul-betul. Yang ni ada 31. Maksudnya dia ada beza. Ni 41. Tak ada perfectly equal. Okay. Random assignments is performed so there is no selection bias and obtain comparable groups. Okay. Biasanya random assignment ni kita buat pakai sistem so that kita takkan ada selection bias. Okay. Equal groups. Okay. The groups must be equal. So any difference in outcomes measured will be attributed only to the interventions, not to the initial difference between the two groups. Okay. So that's the reason why it must be equal from the beginnings because kita nak tengok nanti bila ada outcome betul-betul is due to interventions, not due to the initial difference between the two groups. Okay. It has advantage of a static group comparison. Remember just now the static group comparison. Okay. Because dalam static group comparison, there is no random assignment and the initial difference in group characteristics can influence the study outcomes. So it will act as important source of bias. Okay? Dalam static group just now, tak ada random assignment. Okay, memang ada 2 group tapi tak ada random assignment. So maybe the difference, okay, would be the source of bias actually. Okay. Now, number 2, you are able to control external factors. Okay. There is simultaneity in measuring both groups control factors that change according to time. Okay. Kita control external factors. Lepas tu kita monitor both groups ni over the times, as we would like to see whether there may be an effect to the outcomes and be the bias of the study. Okay, and we only use one measurements of control factors related to the instruments for measuring the outcomes. Some were standardized, only one measurement of control factors related to instrument. Okay, finally, we use a control group control history so that we can adjust the events effect that can happen at the same time as intervention and influence the outcome. So by doing so, the risk of arrival hypothesis and potential source bias can be eliminated. Okay, so that's the good thing of being control external factors. And what does it mean by maintenance of participant anonymity? Okay, bila the subject are measured before and after intervention, okay, the information tools will be will be kept in the system. Okay, so you need to have some sort of system uh, install so that you know which measurement correspond to which participant. Sebab kita tak nak letak contoh nama sekian-sekian, ID nama sekian-sekian, this is the result. Usually kita pakai satu sistem yang mana kita panggil patient identification, yang that particular patient identification itulah yang kita masukkan ke dalam sistem. Okay. The participants' ID, names or phone number will be recorded in database which may interfere with some types of studies where the participant anonymity is critical. Okay. So, dalam kes ni, bila kita pakai satu sistem, kita able to maintain participant anonymity because the case record form yang asal-asal memang ada patient particular, tapi bila masuk dalam sistem, kita pakai patient so-called research ID number lah, bukan real ID number. Okay. And it is not affected by reaction to pre-testing. What does it mean by that? Okay. Do you know that pre-testing may, subject the patients to additional source of bias? Kenapa? Sebab bila dah ada pre-test, and then kita buat intervention, dan kita buat pre-test, buat post-test, the post-test result tu can be influenced by the result of the pre-test. Okay? Contoh, the physician might be influenced by previous diagnosis made. Contoh, kita dah test satu patient, kita kata, oh dia ni hemoglobin A1C dia, contoh di group of patient, tadi patient diabetik lah. Memang poorly control. Okay? So, bila kita bagi intervention, kan, kita dan kita buat proses, kita masih lagi, ingat that the pretest result is too tinggi, so doing somehow, this is the human error lah, the human bias. Okay? Kita may bagi tahu patient that you need to strictly follow these advices, you need to strictly do this physical activity. If not, you punya hemoglobin A1C tidak akan jadi control. Okay? So, kita akan ada kita akan adalah penyebab kepada kenapa post-test result tu di-influencekan oleh the pre-test result tu. Because we know that this is so bad, so we need to do some additional things lah to make sure that when we repeat the post-test after some sort of intervention, which is a drug, actually the intervention, tapi kita ada benda yang kita tak control, which is our behaviour to, to advise patient to be strictly follow to this one compared to other patient yang memang dah cantik dah in the beginning kan. Okay. Oh, another example adalah, contohlah kalau you pergi exam first time, pergi exam cater first time, fail, you tahu tak, oh you punya masalah adalah bukit you because you selalu berdebar. Okay. So you be going back home, you akan, prepare bukit, naik bukit more than, road testing kan. Okay. Then bila pergi dekat exam nanti, you dah well prepared because you dah sensitized to the pretest actually. Okay. So study involving a pretest may be measuring the effect of the intervention along with this retest effect. Kan? Kita maybe measure the intervention which is actually drug, tapi kita juga may measure the retest effect, aka sensitizations to the pretest. Okay. as this design does not have any pretest, so your subject, okay, your studies is not subjected to this bias actually. Okay, right now. And it's good because you can perform this one, okay, for those study yang pretest is not possible. Very useful when measurement is size is very expensive either in terms of time and money, okay. Terutama kalau lah bila you tahu you nak buat test is very expensive, okay. Then kalau you conduct what do you call a study that does not require a pretest, okay, this is a very good what do you call design for you, okay. And you saw also when the result can be easily predicted or constant. Just like tadilah, you tahu dah kalau dah ada pretest, balik nanti study back, study hard, the same questions and then you go back to take exam, the result is already be predicted. Memang boleh score lah because dah hafal kan. Ni another example lah. A pretest is unnecessary if the outcome we want to measure is mortality and all participants are alive at the start of the study. Macam mana nak test, buat pretest mortality in the beginning kan, because kita nak measure the mortality at the end. Okay, right. Now the problem with the what do you call this design adalah high risk of attrition bias. Kenapa ada high risk of attrition bias? Because let's say participant quitting the study for different reason between the study groups, making the groups not equal anymore. Contoh tadi ada 20-20. Tiba-tiba dalam group A ni ramainya yang quit. Jadi the study tu tak equal anymore. So the risk of attrition bias is higher bila intervention takes a long period of time to be implemented in the order of days or weeks. So lagi lama you know you punya study period tu, lagi tinggi risk untuk you ada attrition bias. Okay, so bila you know ini berlaku, absence of the pretest tadi make it very hard for you to detect and control this bias because tak ada pretest. So result nak compare between this group dah tak balance dah. So nak compare between pretest and post-test, there is no pretest for you to compare with. Okay, so that's why this study has a high risk of attrition bias. Okay. Number 2, intervention's effect on subgroup unclear. You cannot compare the outcome with pretest measures. Sebab tak ada pretest kan? And you cannot investigate which subgroups of participants responded more to the treatment or which subgroup did not respond well. Okay? Because you only have 2 groups. Right. And it require large sample size. Minimum sample size required for this study will be larger compared to study without random assignment. Okay? Kalau quasi experiment, smaller study size. Remember, kalau tu dia lagi besar. Okay, randomness can correct the difference between the treatment and control groups better as the sample gets larger. Kenapa kita perlu a large sample size? Okay, sebab any difference between the treatment control group, okay, will be corrected bila lagi besar you punya sample size. Okay. Number 3 adalah less generalizability. Okay, it has a low extendability. Kenapa? Because study participants may be different from those in the population on which we would like our result to generalize. Okay, biarlah kita ambil yang perfect inclusion exclusion criteria. Age must be between this and that. Okay, and then should have hemoglobin A1C. I bagi contoh yang biasa saya buat lah. Contoh, age must be between 18 to 45 years old. But what about those yang age 50, 60? Because bila kita pasarkan that particular medication, kita pasarkan for all diabetic patient. So this one tak termasuk. And you know, hemoglobin A1C between 7 to 10. Usually kalau studies dia tak hemoglobin A1C dia nak between 7 to 10. Okay, reason B adalah dia kata because kalau more than 10 maksudnya diabetes poorly control, then they need to be on insulin kan. So they don't the researchers tak nak ambil risk yang mana there be a dropout because of the poor control. Bila dia perlu insulin dia kena you know withdraw from the study lah. So that's why they're strictly saying 7 to 10 kan. So what I'm trying to say is that we cannot generalize the result because the study participants may be different from those in the population. Okay. And number 2, experiment happen in a closed and controlled environment, which is not always representative of the real world scenario. Okay. Why we say a closed and controlled environment? Walaupun the field, we are conducted in the field. Okay, we call it field experiment sebab kita control patient from A to Z. Patient needs to come to see us every week, every month. Okay. Every time dia datang memang dia jumpa kita dan kita dah ada dah kita punya list of things that we were supposed to advise them. Okay, what about in the real world? Okay, which is not control. Okay, they see another doctors. That doctors tu very busy, tak ada masa nak bagi advices, or doktor tu tak tahu nak bagi advice apa, that kind of thing. So when we compare with the real world scenario, it's not always representative of this real world scenario. Okay, that's why he has a low external validity. Highly controlled study lead to high internal validity because kita memang controls very strictly control, so high internal validity, so less bias. However, it has low external validity due to low generalizability. Okay, right. Now, this is the example for post-test only control group research. We identify a study participant and randomly assign into treatments group or control groups. And we don't perform any tests, but we just observe and we give interventions over here. And after that, we do one post-interventions measurements. Okay. Now, let's say our study population adalah teachers, okay, would like to test whether the knowledge attitude, kita panggil KPs tadi, knowledge attitudes and perceptions of teacher of some subject lah. Let's say I'm trying to look for whether this group of teachers have knowledge, what is their attitudes, what is the perceptions with regard to the sexual health education among the school children. Yeah? So that 100 teachers randomly assigned into two groups. Okay, the first group will be given trainings or workshop with regard to sexual health education. The other group does not have a training, and we perform a post test, and we can say that those who receive the training who have a better result compared to those who does not receive training. Okay, so however, kita tak tahu sama ada bila kita buat pretest tu, awal-awal tu dekat sini memang dah dia punya knowledge of the sexual health education tu memang dah very poor from the beginning compared to this one. Okay, so this is post-test on the control group studies. Okay, second thing adalah pretest post-test control group research. Okay, dalam kes ni apa berlaku adalah, okay, this is the commonest design used in randomized control trial. It's also called a pre-test, post-test, and randomized control trial. Okay, objective adalah to measure the intervention effect. Sama juga, outcome interest adalah measured twice for all groups, once before the treatment groups activations, which is we call the pre-test, and once after treatment we call it post-test. So basically, bezanya antara pre-test, post-test dengan post-test tadi adalah dalam pre-test, post-test dia ada dua lah. Or they call measurement taken, satu before the intervention, yang kedua selepas intervention. So if there is difference observed between these two groups, we assume that this is due to treatment result. Okay, usually dalam kes apa kita buat, dalam kes medical education policy and etc lah. Okay, right. So macam just now, you identify you punya study population, when you recruit the patients based on the punya eligibility criteria, and you randomize into two groups. Okay, which is the control groups and also the intervention groups. Okay, both groups ni kena ada intervention, kena ada pretest. Lepas ada pretest, intervention group will receive treatments, and after that both group will receive post-test. Okay, right. Now, what are the characteristics to be considered this is pretest, post-test control group? Okay, the three major characteristics. Number one, a random assignment. Okay, there must be a random assignment to either treatment or control groups, and this should occur before or after the pretest. Okay, so basically they were supposed to randomly assign, bukannya you just assign it according to you punya you punya preference lah, but it must be randomly assigned. Okay, and both group are exposed to same condition except for intervention, yang mana treatment group will receive intervention, whereas control groups does not receive intervention because they will add a comparison group. Okay, and both groups are simultaneously measured on the outcomes at 2 point of time, which is before the intervention we call it pre-test, and the after the intervention we call it post-test. Okay, so this is what happened in pre-test, post-test control research group. Okay, you got identify a population such as a group of diabetic patients, and then you randomly assign into experimental groups and control groups. Both group will have one pretest before intervention started for the experimental groups, and then you observe. Then the other groups after receive the interventions, both group will receive the the post test. Okay, so only then you can say that intervention was effective to these groups or not. Okay, right now. So what is the bad thing and good things? What is the good thing and bad thing about the pre-post? Okay, pre-test and post-test control groups. The good thing adalah it can control all internal threats to validity, because you ada pre-test, you ada control groups, you ada random assignment. So they control all threats to internal validity. Okay, all internal threats to validity. Okay. Yang kedua, there is a clear intervening effect in relations between two variables, external variables and also independent variables. Dia dah ada dah. Dia punya intervening effect between these two groups. The problem adalah outcomes of this randomized study may not be generalized well to the population, because remember just now the participant might not be typical people in the population, may not represent well the population of interest. As mentioned just now, because you pre-select the what do you call the study sample based on you punya inclusion exclusion criteria. So those yang you tak select tu, so what about then? Because when you so called market the interventions, market the treatments, market the drugs nanti, all these people yang label as diabetic, diagnosed as diabetic, will be given these drugs actually. Okay, right now. So let's look at the advantages, the pros cons about the pretest, what do you call, about the pretest post-test control research actually. So because pretest post-test ada pretest measurement, by having a pretest measurement, it increase the power of the study. Because this power, the design of the study, we be able to detect an effect actually. And it allows you to study the intervention effect at the different sub-level of the pretest. Okay. You also helps you to analyze initial difference between the groups. Therefore, you are able to quantify the effects on the study outcomes. Okay. And you have to control the attrition bias, because the unequal loss to follow-up of the participant between treatment group and control group, which can affect the outcome measures at the post-test. Okay. Right now, by having a random assignment and control groups, okay, randomizations allows you to have unbiased assignments of participant to treatment group. So you be having a very comparable study group actually. And bila you ada random assignments and control groups, you boleh tengok sama ada the effect tu is due to effect of times or not, because it would, kalau ada effect of time, it would affect both treatment groups and control groups. So you can see, let's say at the end of the at the end of your study, you can see there is a reduction of hemoglobin A1C after intervention. But then the good things adalah because you boleh tengok dia punya effect over times in both treatment group and control groups. Okay, kalau berlaku dia kata because of the long duration of follow up with us, it should happen in both groups lah kan. Tapi kalau because of intervention, it should happen in the intervention groups only. Okay, and the co-occurring event, when you look at the history with the, because when we do the what do you call the case record form for both treatment groups and control group, we documents the co-occurring events including the history in both treatment groups. So we will know that okay, this is actually from the history. Contoh, at the end of the day you nampak dalam patient yang ada control group ni ramai yang ada diabetic kidney disease. Okay, tapi because all this history, all this co-occurring event you dah commented earlier, you tahu it is not due to because they don't receive treatment, but because is their what do you call underlying medical history itself actually. Yeah, the effect of pre-test and post-test affect both treatment and control groups. Okay, treatment groups and control groups outcome combination help to resolve the regression of post-test toward means, and pre-test scores are good. Okay, dan macam ni, kalau remember just now I cakap sensitizations of the pre-test kan, bila ada treatment group dan control group ni, dia boleh resolve regression of post-test towards mean. Maksudnya tadi, kalau lah kita tengok post-test result ni, and then bila dah ada pre-test, dia akan regress toward the mean lah kan. Tapi bila ada treatment group and control group, dia akan resolve this regression. Kita kata dah, kita nampak dua-dua jadi macam ni, not because of the intervention, but because of the regression of post-test work mean. Okay. Right now, reason for limitation, population of interest is, let's say, you got population of interest which is eligible for the experiments. Okay, so you need to know your limitations. Yeah, you got numbers, you got population that will be eligible for experiment. Tapi adakah yang interest tu eligible? Kalau eligible, adakah mereka boleh be recruited? Kalau recruited, kita katakan kita recruit to study, adakah mereka consented? And then bila mereka consented, adakah mereka being randomized? Kan? Because bila you ada randomized control trial macam ni, dia you need to fulfill a very strict inclusion exclusion criteria. Okay, I bagi you a scenario. Okay, I got lots of diabetic patients in my clinic, and when I go through their database, and I know that I got pool of patients who are eligible. Okay, so when they're eligible, so I recruit them into the study. During the recruitment process, you may find a patient who does not want to be involved with the study, so they refused to be included in the study. Okay. And then bila dia orang tak consented for the study, tak boleh masuk. Kalau ada consent, so it left you small number lah yang consented pula. Then you need to do some tests. For instance, okay, bila one of the study criteria saying that, okay, beside being diabetic, they were supposed to have this BMI between 37 to 40 kilogram per meter square, kan? They were supposed to have hemoglobin A1C between 7 to 10. And then when you looking for the inclusion exclusion criteria, after you do some tests, some of them might not be able to randomize because they don't fulfill the inclusion and exclusion criteria. So this is the problem with the randomized control trial, because they have a strict inclusion exclusion criteria, and they need to be randomly assigned so that the group will be equal and comparable. Okay. And next one adalah they cannot study treatment change effect over times. Okay. Bila cannot study treatment changes effect over time, solution adalah they add more post test. Okay. Add more post test so that you can see kalau after 1 month macam mana, 3 months macam mana. Okay. Right. Susceptible for interaction between intervention and other factors such as pre-test, history, intervention, and etc. So kalau ada possible interaction between intervention and other factors, usually kita suggest towards Solomon 4 groups. Okay. Right now, so in pre-test post-test control trial, okay, you identify your study population, your study of interest, and then you divide it into treatment group and control group. Not simple divisions, but the randomly assigned to treatment group and control group. You do some pre-test, give some intervention to the treatment groups, and repeat the test after the interventions, and collect the data and analyze data. Okay, so this is the same thing that I mentioned just now. Okay, you do a pre-test post-test control group research. So at the end of the day, you can see that those yang receive treatments, those yang treatments or interventions, so what be the effect compared to those yang tak receive treatments or interventions. Okay, right now, Solomon 4 group research. Okay, this is actually combination of pre-test only and pre-test post-test control groups. Okay, dia ada dua-dua, ada pre-test only and pre-test post control group. Objective adalah untuk assess the efficacy of the intervention, and remember, assignment of participants should be done randomly, and there is simultaneous measurement of the outcomes of interest across the groups. Design is asymmetric. Okay, kenapa kita kata asymmetric? Nanti I tunjuk kat you. Okay, but basically dia akan ada 4 groups. Only participant in groups 1A and 2A receive pretest measurement, whereas all participants in all groups receive post-test measurement. Okay, 1B, 2B, 3B, and 4B. Okay, so this is what I mentioned. What I meant just now. You identify your study population of interest. Daripada situ you divide it into 4 groups randomly. Divide into 4 groups. Okay, you got experimental group A and also experimental group B. Experimental group A will receive pre-test, whereas experimental group B won't receive a pre-test. Then you have a control groups. You got control group A dengan control group B. Control group A will have pre-test, whereas the control group B won't have a pre-test. Okay. Then the experimental group ni, Group A and Group B will receive a treatment. Okay. And at the end of the study, all 4 groups will receive the post-test. Right now. So as mentioned just now, you need to have a 4 group which is randomly assigned. Okay. Then these 4 group will differ whether they receive treatment or not. Okay. And the outcomes of interest is measured whether once or twice in each group. Okay. So for groups in the experimental group, treatment group with both pre-test and post-test, kita panggil sebagai pre-intervention and post-intervention measurement, ataupun experimental group with post-test only measurement, ataupun control group control group with both pre-test and post-test, and finally control group with post-test only measurement. So there will be 4 groups, 2 experimental, 2 control groups. Okay. For each experimental and control groups, only one group receive pre-test, another group pre-test and post-test. Sama juga untuk control groups. Okay. Right. So again, okay, you have 4 groups. Okay. 2 group akan receive pre-test which is experimental group dengan control groups. Okay. Whereas another 2 groups takkan ada pre-test. Okay. 2 group akan ada intervention. 1 group under experimental group akan receive interventions. Yang one group under yang receive pre-test akan ada intervention, another groups yang tidak ada pre-test akan receive intervention. At the end of the day, sorry. Okay. Kita akan measure dia punya outcome. Right. So, we have to look for what is the good things of these advantages and disadvantages when conducting this summer for group research. No? The good things adalah it resembles to group experimental design. Okay, but it's better than standard to group design. In this case, it helps in detecting pre-test sensitization. Sebab tadi kenapa? Sebab tadi kalau perasan experimental group tu tadi ada satu ada pre-test, ada satu tak ada. So it's able to detect pre-test sensitization. Okay. The bad things adalah it is very costly, so it's really been used in practice. Okay. Kenapa it's very costly? Because compared to a standard design with 2 groups, it requires twice sample size, twice times, twice material, twice resource, and twice personnel or work. So, it's very costly, it's very expensive, and it's very impractical because of that cost actually. Right now, when we say that good thing adalah resemble 2 group experimental design adalah yang mana the first 2 group resemble the pre-test post-test control group design, and the first groups adalah 2 groups ada yang resemble the pre-test post-test control design ni, dia enough to control threats in terms of internal validity. Sebab dia ada pre-test post-test kat dia kan, so dia boleh dia boleh eliminate ataupun dia boleh control the threats to internal validity, such as the effect of the selection bias, history, maturation, regression to mean, instrumentation, and mortality. The one that I bagi contoh in the beginning tadi lah. But it's better than to standard group design. Kenapa? Besides control threats to internal validity, okay, due to bias and confounding factors, which is similar to standard 2 group just now. Okay, it's also control threats to external validity. Okay, because the pre-test sensitization where a standard 2 group experimental design cannot control. Because ada ni dia ada satu lagi group yang tak ada pre-test. So dia akan control threats to external validity. Right. So the good things when we are able to detect pre-test sensitization. Okay, kenapa pentingnya pre-test sensitization ni? Sebab pre-test sensitization ni adalah interaction between pre-test and also treatment. So this will occur bila adanya pre-test, sebab pre-test akan increase atau decrease participant responsiveness to study treatment. Okay, effect of the pre-test itself to the study participant tu. Okay, so number 2, bila kita able to detect pre-test sensitization, okay, for all you know, dia boleh ada generalizability ataupun externality problem. Okay, kenapa boleh ada externality problem? Kerana general population where your study participant was selected for the study will not be pre-tested. Okay, generally, mana kita pre-test ini study population? Not population. Because real population yang akan mendapat intervention tu. So, this particular general population yang may have the treatments to one day will not be sensitive to the intervention. So, the intervention effect on the general population will be different than the one detected in the study. Okay? That's the reason why kita kena detect pretest sensitization, sebab kita nak make sure kalaulah ada that particular result, that particular outcome is due to what they call pretest sensitization, is not due to the intervention itself. Nah? So nanti bila kita nak bagi kat patient, kita tahu okay, exclude the pretest sensitization in real life by right, this good actually. Okay. And this pretest sensitization will exist if pretest influence the outcomes of the post-test. Okay, only the present treatment. Remember just now, the pretest influence the post-test, berlakulah pretest sensitization. And the difference between these two quantities, effect of the pretest is different in the present treatment. It shows that interactions between pretest and treatment. Okay, kalau effect of the pretest is different kalau ada treatment versus tadi ada pretest tapi tak ada treatment, so it means that there is interaction between pretest and treatment. Okay, so how to detect pretest sensitization? Okay, number one, calculate pretest effect on the outcomes of post-test, the presence of treatment difference between 1B and 3B. Nanti saya tunjuk balik tadi lah. And you kena calculate pretest effect on the outcomes of post-test in the absence of the treatment. Tadi dengan present ni, kalau tak ada treatment macam mana? Kalau ada treatment macam mana? Okay. And you compare result of step 1 and step 2 tadi. Tengok difference between those. Okay. In step 1 and step 2. Maksudnya, apa result pretest dalam on the outcome of the post-test dalam yang tak ada treatment versus dengan yang ada treatment. Okay. Right now. So, in Solomon 4 group just now, remember you ada 4 group. Dua group akan receive treatment, dua group akan act as a control. Satu group receive treatment akan ada pretest, satu group tidak akan ada pretest. So yang tak ada pretest, so you akan able to desensitize the pretest actually. Right? Sama juga dengan control groups. Right. So this is example. Tadi we got 100 teacher, tadi kita divided into 50. Now kita divided into 25 teacher. Okay, and there were that only 2 groups akan receive what do you call a module ataupun training on sexual health education. Another two will act as control. Okay, one of the group in the intervention phase and one group in the control phase will have the pretest before kita bagi intervention for the treatment groups. And finally, all 4 group will receive the post-test. So, kita boleh tengok. Katakan, bila kita buat post-test tu, oh, those yang receive intervention, okay, result pre-test, result dia macam ni. Those yang receive intervention, dan dia ada pre-test untuk dia evaluate, validate dia punya knowledge, attitude, perception at that time, may have a different result. Okay, but whatever it is, okay, bila kita ada 4 groups that would have a different kind of result macam ni, bila kita compare, bila kita buat analisis, okay, kita akan tahu whether it's a true effect of your interventions ataupun there is it is due to you punya what they call a threat to punya internal ability due to no pretest. Okay, right. As a conclusion, right. So this is a comparison between these three. Saya nak tahu. Okay. Tak gerak. Right, tak apalah, tak gerak. Okay, macam ni. So, between pre, quasi and true experimental research, okay, let's look at the whether presence of control group or not. Okay, for pre-experimental research, sometimes, okay, you may have a control groups. Quasi-experimental research, you may have a control group. Tapi kalau untuk true experimental research, usually they should have a control groups. Okay, and oh ya Allah, tak bergerak dah. Dah. Okay. And when we talk about randomizations, okay, random selection, hanya dalam true experimental research yang ada random selection, random assignments of group, and random assignments of treatments to the groups. Okay, so basically everything is done randomly dalam through experimental research in comparison dengan pre dengan quasi. Okay, so remember randomization, if there is no randomization, dia adalah trap for you punya internal validity. Dia akan kacau you punya result because you tak randomly assign your drugs to your study participants. Okay, and with regard to the degree of control over extraneous variables, okay, dalam through experimental design, you have a control over your extraneous variable. Dalam quasi, you may have, you may not lah. Okay, so bila you compare all these three, you can say that the true experimental research design is the best, is the ideal, is the gold standards of experimental research design sebab dia ada control groups, dia ada randomizations, and they are able to control all these extraneous variable ataupun control variable. So baru result you solely valid and accurate. Okay, right now. Okay, this is again just to show to you comparison between non-experimental, quasi-experimental dengan experimental. Kalau dalam case non-experimental, you tak ada comparison groups, okay, and you only measure outcomes before and after programs for participants only. So it just said, you know, you have one groups and then you buat pre-test for these groups and then you bagi program, you buat programs and then you measure the pre-test, the post-test. Ataupun you tak buat pun pre-test, you bagi program and you terus buat the post-test. Okay. Dalam quasi, you measure outcomes for the program participants and non-participant without random assignment. You ada dua groups. Okay. Yang participate dalam programs dan tak participate dalam programs. Tapi the groups, you know, are subjected for bias because there is no control for the bias. Okay. And they have a comparison groups. Okay. In comparison to experimental research atau through experimental research, kita panggil randomized control trial. The study participants are randomly assigned to treatments or control groups. Okay, they were divided randomly into two groups, and they were also randomly given treatments, and they measure outcomes for both groups, so they can see the comparison between these two groups. Okay, right. Now, some tips and tricks in conducting experimental research. Okay, the 3 tips. Okay, got a lot tapi I just bagi 3, susah nak hafal banyak-banyak kan. You need to make sure that when you design your experimental research, you need to design it carefully. Macam mana cara nak design it carefully? You need to have a clear research questions. Apa yang you nak buat? Contoh, with drug A cause improvements of the blood pressure in hypertensive patients. Okay, so this is your research question. Would drug A cause a reduction of blood pressure, systolic pressure by 20 degree, diastolic pressure by 10 mmHg, contoh ni kan. So you kena ada clear research, bukan cakap can drug A improve diabetic control, tidak boleh. It is not clear. Kan, you tak boleh nak measure kalau macam tu. Okay, so you need to choose the design that will allow you to answer the question. So you can tengok design mana yang sesuai dengan you punya research question you. Okay, and make sure that your experiment is ethical. Okay, one of the thing that you need to remember that you should fully inform your participant. Bila kata-kata fully inform, you kena inform this is what I'm going to do. Maksudnya the study protocol. What am I going to do with you? What am I collecting? Okay, what be the possible risk? What be your possible benefit? What if you have a problems? All the details must be fully informed to your patient so that when your patients make the decisions, they are fully informed and they consented it willingly. Okay, and make sure that when you conduct the trial, you are not going to expose your patient to any unnecessary risks. Okay. And number 3, ensure the experiment is reliable. What does it mean by ensure your experiment is reliable? Use standard procedure to gather the data. Make sure bila you nak buat tu, you guna standard procedure to get your data. Okay. What we mean by standard procedure, contoh, macam tadi kan, nak tengok sama ada there is a BP reduction kan. So that particular procedure tu, you kena guna a standard ataupun instrument, the right instrument. That instrument must be properly maintained, calibrated, kan? Use the right curve. So use the standard procedure. Kalau lah you tak guna standard procedure, contoh orang tu obese, you guna small carb for small children, then you might got a wrong result. And so your data will be, inaccurate data. Okay. And you also need to have a clear procedure for recording and storing. Okay, you kena make sure you understand the procedure, how to record the data and how to store the data, so that the data punya integrity itu, and patient punya privacy and confidential tu will be taken care. Okay, right now. Three sites in experimental research. Okay, let's say you decide to do experimental research. What you need to do, number one adalah designing your experimental research. As mentioned just now, make sure you formulate research questions. Okay, identify what be your dependent variables, what be your independent variables, identify your relevant study population, and select the study subject from that population that you have identified. Okay, number two, when you are conducting the research, make sure your study participants will be randomized. Okay, and there should be a blinding. Single blinding maksudnya patient tak tahu pun pasal they're not aware whether they got the drugs ataupun they got the placebo. Okay, double blinded. Okay, patient tak tahu, you tak tahu. Okay, sometimes kita kata ada triple blinded. Triple blinded ni patient won't know whether they got intervention or not. Researcher won't know, will not know lah. And finally, those yang analyze the data, kita pun tak tahu. Kita panggil the statistician pun tak tahu. You just analyze the data. Okay, triple blinded. And there should be a pre-test. Okay, so that you boleh control dia punya internal treatment to experimental groups and also post-test. So this is the the running of the experimental research. And finally, okay, you need to analyze the data. During analyzing of your data, you were supposed to have an initial descriptive statistics so that you can see whether your study populations is equal, okay, comparable or not. And then you need to compare the post-test of experimental control groups and experimental groups and control groups. You need to test your hypothesis and you need to evaluate your experiments actually. Okay, right. Now, take home message. Now, if you like to conduct experimental research, okay, please conduct randomized controlled clinical trial because that is indeed the gold standard for experimental research. The rest, you can conduct a cohort study, case control study, cross-sectional study, case series or case report, kan? But then you punya kita panggil apa, validity tu is less compared to randomized control trial. Right. With that, I thank you. Any questions? Is there any questions? Right, if there is no questions, that's it.
Assalamualaikum.
Yeah, salam terdapat.
Yeah, I'm Afiq, I'm a master student. I'm just wondering, is it affect our study in a master level or PhD level if the type of the experiment is just a non-experimental or quasi-experimental or a true experimental?
If you remember the one that I've shared with you just now, kan? The study design actually, which study design would you choose actually? It depends what type of study that you want to conduct. Okay, you boleh je buat yang kalau quasi ke. Remember just now kalau you nak buat pilot study, you rasa macam you only have 1 year, master's program 1 tahun kan? Kau dah 2 tahun.
2 years.
2 years. Might not be enough for you kalau you buat a true experimental research. Okay, so you might need to conduct a quasi. Boleh je. Or you might do a pre-experimental. Boleh je. Tapi you must have a justifiable reasons lah. Kenapa you nak buat macam ni. And then whether by doing that, you punya result tu valid tak valid. Boleh je. You nak buat observational study pun boleh. Tengok apa yang you nak provekan. Apa you punya research hypothesis you. okay boleh je, ramai je yang buat macam comparative retrospective study, cross sectional study. Kebanyakan student akan buat cross sectional study sebab dia you just need to have a very short time lah compared to randomized control trial. Kalau control trial ni, because it will be a prospective, you kena follow up patient lama. Okay, kalau 2 tahun might be not enough. Kenapa? Because the first 6 months tu biasanya you akan prepare your research proposal, defend it, kan. The second semester tu barulah you start collecting data, and the third month tu dah you nak analysis. Tapi kalau you betul-betul nak buat randomized control trial, which is prospective study, 6 month data collection, it will not be enough. So it depends lah, depends pada apa yang you nak buat. Biasanya kalau PhD student, they would do what they call experimental research, because dia punya time frame dia lagi lama, 3 tahun, 4 tahun, 5 tahun kan. Tapi biasanya kalau masa science, they would do something yang require a shorter time lah for them to complete research.
Okay, thank you.
Okay, welcome. Is there any more questions? If there is no more question, I'll give it back the floor to the moderator. Thank you very much. Okay,
Okay, thank you, Doctor. Okay, to all students, we see you again at 2:30. Thank you.
Recording stopped.